Hi there. Welcome. Come on in and get yourself nice and comfortable. And how are you today? Okay, well, I can see that you're here for an annual physical exam today. Is that right? Great. Well, what we're going to do is start with a questionnaire about your health in general, your health over the past year, and then a few tests looking at heart rate, blood pressure, mobility, eyes, ears, reflexes, all those kinds of things. Is that okay? Great. Let's get started then with a questionnaire. Nothing too tricky. So to begin with, are you currently being treated for any medical conditions, either long term or in the past year? And when was your last medical checkup? Has there been any change to your general health in the last 12 months? Okay. Are you taking any medication, non-prescription drugs, or herbal supplements of any kind? And if so, which? Okay. Do you have any allergies at all? Okay. And have you ever had an adverse reaction to any medicines or injections at all? Okay. That's one page done. One to go. Do you have or have you ever had asthma? Do you have or have you ever had any heart or blood pressure problems? Do you have any prosthetic or artificial joints at all? Have you ever had jaundice or liver disease? Do you have any bleeding problems or bleeding disorders? Have you ever been hospitalised for any illness or operations, and if so, what? Okay. Next, there's a list coming up, just for yes or no. Do you have or have you ever had any of the following, please? Any chest pain at all? Any rheumatic fever? Any seizures or epilepsy? Ever had a heart attack at all? Any lung disease? Diabetes? Any kidney disease at all? Stroke? Ever had tuberculosis? Ever suffered with stomach ulcers? Had any kind of thyroid disease at all? Ever suffered from shortness of breath? Any arthritis? Thank you. And are there any conditions or diseases that I haven't listed that you have or have had? Are there any diseases or medical problems which run in your family? So, diabetes, heart disease, anything like that? Do you smoke or chew tobacco products at all? Bit of an odd question. Do you get nervous during dental treatment? And finally, is there anything else that you would like me to know in regards to your medical history or current medical conditions before we start? Fantastic. That's all the questions. So what I'd like to do first is take your blood pressure, if I may. Just start by putting on a pair of gloves. Have you had your blood pressure taken before? Okay. Well, it's much the same. Don't worry, I'll explain everything as we go. If you have any questions, just ask. What we'll do is, it's just a cuff like this. We'll slide it over this arm and then it will inflate using this machine. It'll get quite tight and then ease off as the machine reads your blood pressure. Okay? Great. Is this arm okay to use? Fantastic. So, slide this arm in for me, please. That's great. Let's do this up. Thank you. And then what we'll do is we'll press the button and it will get quite tight. Ready? Okay, here we go. Just give that a few seconds. You should feel that pressure start to ease off. Perfect. Just take this off. And slide that arm out for me. Fantastic. Thank you very much. Make a note so I don't forget. Was that okay? Fantastic. Next, what I'd like to do is use the stethoscope. Just have a listen to your chest and your lungs. So, listening at the front first, and then I'll just be going behind you to listen to your back, to your lungs. Is that okay? Yeah. All you need to do is breathe normally. The only thing I will say is this might be a little bit cold to begin with, okay? Fantastic. Okay, so just breathing normally for me. This side of your chest first, and then this side, okay? Ready? Fantastic. Okay, here we go. Sorry if it's cold. Just breathing normally for me. Fantastic. and then this side. Ready? Okay, we go. Okay, great. And now I'm just going to go around behind you and just ask you to take a few deep breaths for me. Is that okay? Okay, here we go. Let's go around the back. So a nice deep breath in for me, please. And out. Deep breath in for me, please. And out. Deep breath in for me, please. And out. That's fantastic. Thank you very much. No problems there. Was everything okay? Yep, fantastic. Make a note of that as well. Next, it might feel a little strange, but I would just like you to continue breathing normally. I'm just going to be looking at that respiration rate, how many times over the course of a few seconds you're breathing. So it will feel a little bit odd to start with, but breathe normally for me, please. That's great. Thank you very much. What I'd like to do next is take your temperature, if possible, please. Just using the thermometer. It's going to go underneath your tongue, just to check that your temperature is normal. Is that okay? Great. Open wide for me. Okay, here we go. That's great. Thank you very much. That's good. Temperature's normal, as we would expect. Let's make a note. Next, I'm going to give you a short sequence of numbers to remember, just a quick memory test. And I'll be asking you for these again at the end, okay? So it's 6 numbers, and they are 1, 5, 6, 9, 0, 2. One more time for you. 1, 5, 6, 9, 0, 2. Okay. See if you can put those in your memory, and I'll ask you for them again at the end. In the meantime, next I'd like to take a look at your mobility, if that's okay. So to begin with, if you could please raise your arms for me. Firstly out to the side, then out to the front, and then over your head, please. So firstly, out to the side for me, just holding them up for 1 second. Marvellous, thank you. Out to the front for me, please. That's great, and then up over your head, please. Fantastic. Thank you very much. Next, if you could shrug your shoulders for me, please. Fantastic. And then if you could circle your head around for me, please. Right the way round, if possible. Fantastic. Thank you very much. You can relax all of that now. That's great. Next, I would like to take a look at your eyes and ears, if possible. But before I do that, as it's all connected, I'd just like to take a little look at those sinuses, if possible. Any problems with your sinuses, any colds, coughs, anything like that recently? Okay. While I feel those sinuses, if there's any discomfort, any pain, tenderness, anything like that, please tell me and I'll stop, okay? Great. Just feeling around those sinuses. Okay. Any problems there at all? Okay, great. So I'm going to take a look in your eyes, just with this one. This is the backs of your eyes first. It's quite a bright light, but I just need you to look straight ahead for me, okay? So I'm going to look in this eye first. Ready? Okay, looking ahead for me. That's fantastic, well done. Give those eyes a blink if you need to. Everything okay? Okay. This eye next, same thing again. Looking straight ahead. Ready? Okay, here we go. Fantastic. Thank you very much. Little blink again. Okay. And then I'm going to have a look around those eyes, just with this light. You don't need to look into the light again, just looking either at me or beyond me. Just be looking around. So, looking straight ahead for me. You'll see the light in this eye first. Ready? Okay, here we go. Just having a really good look. Just at those eyes and around the eyes. Thank you very much. Good blink. Want to make sure we're not dazzled in this eye while we're looking in this one. Okay, ready again with this eye. Fantastic, so looking at me or straight ahead. Ready? Okay. That's great. Thank you very much. Just like the other one, so happy with both of those. You've noticed no problems with the eyes at all? Next, your ears. I'd like to begin just by feeling around the ears and then having a little look in. Is that okay? Great. Again, any discomfort at all, please let me know and we'll stop. Okay, here we go. Fantastic. Did that feel okay? Marvellous. I'm going to have a look in your ears with this little light on there. Just to look at that eardrum, check everything's okay, check there's no wax build-up, anything like that. Okay? Take a look on this side first. Ready? Okay, here we go. Okay, looking into this ear. Looking very good, absolutely clear, no problems in here at all. Good start. This ear next. Ready? Okay, here we go again. Just like the other ear. It's looking very clear indeed. No problems there at all. Well done you on having lovely clean ears. Any problems there at all? Have you noticed any issues with your ears recently? Fantastic. Next, I'd like to take a little look in your mouth if possible. I'd like to have a look at the back of your throat, gums, teeth, tongue, things like that. Is that okay? Okay. What I'm going to do is just use this to hold down your tongue and have a look with my pen light again. Is that okay? Great. So, open wide for me. Thank you. Comes the light. Starting by taking a look at the back of your throat. You could say "ah" for me, please. Fantastic. One more time. "Ah" for me. That's great. Taking a look. Having a really good look around the mouth. Okay. Thank you. If you could stick your tongue out at me, please. Fantastic. And show me those teeth, please. That's great. Thank you. Any problems with the mouth over the last year at all? And are you regularly seeing a dentist? That's great. Next, I'd like to have a little feel around the neck and the throat, and also look at the glands in your throat and the thyroid. Is that okay? Yeah, looking at lymph nodes or things like that. Again, any pain or discomfort, let me know, okay? Okay, here we go. Starting around the back of the neck. Just feeling for any abnormalities. With the lymph nodes, you can tell very quickly. It all feels good to me. It's coming round to the sides now. Okay. Then feeling the glands under the chin. Okay. Okay, onto the front, down here, okay? So when it feels comfortable to do so, if you could swallow for me, please. Fantastic, thank you. That's great. Was that okay? Any discomfort there at all? Okay. What I'd like to do next is take a look at the reflexes in your arms and your legs if possible. So I will be using these to do so. This for your arms and this for your legs. Is that okay? What I'll be doing is I will be looking at the inside of the arms here, giving them a little tap with the hammer. I'll take the weight of your elbow in my hand and then give them a tap, and then we'll do the knees in a similar way. Okay? Great. This arm first if possible, so place your arm out for me. Thank you. And if you let me take the weight behind that elbow. Wonderful. So, quick tap. Ready? Good. And again for me. Yeah, well done. You can take the weight back. Was that okay? Great. This side next. So same thing again, arm out for me. Thank you. I'll take the weight. Same again. Ready? Quick tap. Good. And again. Wonderful. Thank you. Take that weight. That's it. Lovely. Next, with this, one knee at a time. So, this one first. I'm going to do, just with this end, quick tap. Okay, ready? Okay, here we go. Yeah, good. And again for me. Fantastic. Was that okay? Great. This knee next. Same thing again. Ready? Okay, here we go. Was that okay? Great. One more time for me. Fantastic. That's the reflexes done. Any problems there at all? Arms and legs looked good to me. Any pain there? Did everything feel the same? Fantastic. So finally, today, can you remember that sequence of numbers from earlier? A little think. Access those memory banks. Can you remember those numbers? The numbers were 1, 5, 6, 9, 0, 2. We can normally hold anywhere between 5 and 7 digits, so 6 is a lot, it's at that upper end, so there's no problem there at all. Sweet. So, that is your annual physical exam. How was that? Was everything okay? Any problems? Anything that occurred to you while we were going along? Is there anything else that you would like me to add to my notes? These will go on your medical records and stay here either until we see you again or you come for your next annual physical exam. Okay. Well, at any point, you're welcome to come back and see us if there are any tests that you feel need repeating or if you have any worries across the year. You can see us in between these exams, no problem at all. Any concerns whatsoever, then just get in touch and we'll be happy to see you. But in the meantime, thank you so much for coming today. Thank you for doing all of these tests and being very patient with me. And I look forward to seeing you again very soon. Take care. Bye-bye.